Hello and welcome to Alabama Public Health Training Network. Thank you for joining us today for our program, A New Streamlined Application, What It Means for the Plan First program. If you have any questions or about anything being discussed today, feel free to call or email our faculty presenters. The 800 number and the email address are on the screen now and will appear again later in the program. Also, the handouts for this program have already been emailed to you. They include handouts from our two presenters, the 16-page application, and the new poverty level guidelines. They are also readily available from the Alpha or ALPHN-TN website on the schedule page in the course details. Let me also mention that the in-service will also be available as an on-demand program if you or your colleagues need to review this material. So before we meet our faculty, which let me go ahead and introduce them. We have Meredith Adams with the Bureau of Family Health Services. I'm sure you all know her quite well. I know that she's been receiving a lot of email from you. And also Paul McWhorter with the Alabama Medicaid Agency. Welcome to you both. And I want to thank you for being here. And first, let me start off by saying that I know that none of us like change. Let's face it, we really loved that lavender application. It was 3 pages. And when we go to a 16-page application and it's called Streamlined, when we had a 3, it's almost kind of like jumbo shrimp, and some of those words just don't make any sense to us. But there are certain changes that happen, and if you can remember from when you were in high school, for every cause there is an effect. And when ACA came about, there were changes that CMS instituted that had an effect on all Medicaid programs. We had to follow what they said. And so that is actually linking and looking at income tax information. And so that's where some of these questions have come in that we've never had to ask our recipients before. Thus, the reason why we couldn't use the Streamlined, or what we considered Streamlined, our little lavender application. Another thing that we had to do was, anytime in the past, if something wasn't working well with an application, we were just able to just get with Medicaid, we made the change, here's the new document, it was out. Well now, and I don't know if Paul will go into these details, but now any change in this application is scrutinized and has to be approved by not only CMS but by IRS, right? And I know this new Streamlined 16-page application went through quite a process back in December with the IRS. So these are changes that have come not because Medicaid had nothing else to do, or certainly anything that we really wanted to do, but it was a federal change that had to be done and has been strictly enforced. So our hope today was to help go over this application, explain some of the rationale behind some of the questions, and then to be available to answer any questions for you. So please, if we do not answer what you don't know, you need to email today. You certainly need to call in, because now's your opportunity. Although Meredith and I will still be available to help answer things as they come up, we'll do our best to answer them. I know I'm still answering emails from the time that I was out, but please take advantage today of asking those questions. So as we get started, I'm going to now just send it over to Meredith, who's going to give you some background and some of the reasoning behind the changes and what caused some of these changes with the application. Meredith, welcome.
Yes, thank you. Yes, we wanted to take this opportunity to give you some general Affordable Care Act information. And I've tried to kind of turn it into how it's affecting Plan First, but wanted to give you some general information as well. So I wanted to start off first with our acronyms and terms. I know that we were on a webinar a couple of months back, and they started talking about MAGI. We did not know what they were talking about, and we had to Google it. So I thought it might be a good idea for us to start off with just some general acronyms and terms. It's possible you could hear these today, or we could miss them today, but just wanted you to be aware. So to make sure we're all on the same page, ACA is the Affordable Care Act. And when I was talking to Paul right when we got here, he said ACA, and I was like, ACA? Oh, that's ACA. So ACA, or ACA's Affordable Care Act. MAGI is the Modified Adjusted Gross Income. FPL is the federal poverty level. E&E is our new eligibility and enrollment system. And of course, our sober groups. And this is going to include all of our Medicaid for low-income families, our sober women and children. As you are aware, Medicaid is not currently electing to expand. So for those eligible adults under the age of 65 that have dependent children, we did not expand Medicaid. So however, our eligibility limits for Medicaid have changed. So our new eligibility limits, our eligibility is determined with a gross income test. This means there are no disregards. So Medicaid is not being expanded at this time. However, the eligibility limits have changed, meaning more people are in fact eligible for Medicaid. Gross income is what a person makes prior to anything being taken out, such as taxes. It's like on your paycheck. There's the number that you make, and then there's the number that you actually take home. Gross is what you actually make, and net is what you actually take home. Eligibility is determined based on what you make and not what you're actually taking home. So the MLIF group is the parent caregiver group, and the income limits have increased from 133 to 146% of the federal poverty level for SOBRA. So that's a change in our income limits for our Plan First program, which covers our women that are age 19 to 55. So our children that have been traditionally broken down into two groups. We have the birth to age 6 were traditionally eligible for full Medicaid coverage up to 133% of the federal poverty level. And children aged 6 to 19 were eligible for full Medicaid coverage up to 100% of the federal poverty level. So our new eligibility limit has lumped the two groups together, making all children from birth to age 19 up to 146% of the federal poverty level eligible for full Medicaid coverage. So some of those children are going to be transitioning over to full Medicaid that were on All Kids or the Blue Cross Blue Shield insurance. Some of those children that were on Blue Cross Blue Shield that are now switching to full Medicaid may have to find a new physician because the new physician may not take Medicaid. So please be aware that it is possible you could be helping some patients to change their doctors. So we're going to have approximately 25,000 children that are going to transition over. And our All Kids children are going to be those children that are now between 146 and 317% of the federal poverty level. We also wanted to mention that our former foster children are going to stay on their full Medicaid coverage until the age of 26. This follows the increase in coverage age from the ACA, which allows children to continue as a dependent on their parents' insurance even if they are no longer in college. So our new eligibility and enrollment system, which is where this new application is coming from, once the application is completed, it's going to go through a federal data hub that's going to bounce off of other systems. Annie had mentioned previously that the application was developed in conjunction with the IRS. Well, that's because it's going to be bouncing off the IRS systems, the Social Security Administration, Department of Homeland Security, and TOCS in order to determine eligibility. Our eligibility should be instant when the application is completed online, so if all the information is completed, we should know right then what the patient is in fact eligible for. Our new system is also going to allow for automated renewals. The applicant is going to be able to mark to have eligibility renewed for up to 5 years, and we're going to be discussing the application in much more detail in just a minute. The federally facilitated marketplace. All Plan First women that are applying to Plan First are required to be referred to healthcare.gov. So anytime that you have a patient that's applying for Plan First, they also need to be referred to www.healthcare.gov. Plan First does not meet the minimum standard for insurance coverage under ACA. The patient must be referred to healthcare.gov to apply for full coverage insurance. If the patient is over 100% of the federal poverty level and does not apply for health insurance, she will face a penalty. Our role is simply to refer the patient to the marketplace. We will not be assisting with applying for the federal marketplace insurance. We just have to refer the patient to the website. Those individuals that are under 100% of the federal poverty level will not receive a penalty for not buying health insurance. So that is some general background information on the ACA and a little bit about our application. And I'm going to turn it over now to Paul, who is going to discuss with you the new application. So here you go, Paul.
Thank you.
Thank you.
Good morning. Thank you all for joining us. Thank you for giving me this opportunity to join you
We're
today.
glad you could come. Very glad.
Going to be talking about a few things today. It was mentioned a little bit earlier that with the implementation of the Affordable Care Act, it did require that all states began to use a single Streamline application. Now, with this application, it was a model for the states. So, as Annie mentioned, our applications are under much more scrutiny now. So, what we've done is we have accepted the single Streamline applications with a few minor modifications. So, we were able to change some things as it applied to Alabama, but those applications had to be submitted to CMS or the federal government for approval. So that's kind of how we got here and how we got to the single Streamline application. Is that the concept is that the single Streamline application can be used for all what are referred to as insurance affordability programs. Those insurance affordability programs you'll sometimes hear as IAPs. That stands for Medicaid, Child Health Insurance Program, and also the plans that are offered through the federally facilitated marketplace. I'll try not to speak in acronyms. I know we talk a lot about them, and so thank you so much for bringing those to the table, because I will say ACA or ACA or FFM, so I'll try to keep that to a minimum today, but thank you. So we have gone ahead with the single Streamline application. We do want to mention that the online version of the application that was discussed a little earlier is a dynamic process in that it only asks questions that are relevant to what the individual person inputs into the application. So you don't have to go through every field on the online application. So we are certainly encouraging individuals to apply online, because it is a dynamic process. And sometimes when individuals look at the single Streamline paper application, it can kind of be a little bit intimidating. But what we're going to do today is kind of go over the application, discuss a lot of the information that's found within the application and why they're asking for it. But normally an application is sufficient without any further paperwork for most individuals. Meredith did mention that now with the implementation of the Affordable Care Act, we are required to match with what is referred to as a federal data hub. And in that federal data hub, there are different entities such as IRS, which the Department of Homeland Security. You mentioned TALKS. Now that's an acronym, and basically what that is that it is a pretty large payroll company. So actually, it will be able to return to the states when they call up the web service those individuals that are enrolled in TALKS. Now with any company, you can't have all companies in the entire nation under one, but that particular company, it was awarded the grant through CMS because they did meet the standards for the bid that was for that. So if you hear TALKS, that's kind of what it's talking about. It is another one of the services that is within the federal data hub. We want to show the application and kind of go over it step by step. Now this is the paper single Streamline application, and as I mentioned, we did take the application that was provided through the federal government and made minor modifications. If you'll notice, we do have the logo that many of you are familiar with our partners at CHIP with All Kids. So we wanted to have that particular look so that it would be recognizable. So we were able to kind of put our logo, our contact information, and kind of modify it to meet Alabama's need. If you'll also notice, we've put in real bold letters here how to apply online, because certainly that is the preferable method of application, because you do have that opportunity for the application to almost be determined in a real-time or a near real-time manner. So that's we're certainly encouraging insurealabama.org. So I'll just kind of go over the cover page of the application. It gives us a little bit of information about who used this application to see what coverage choices you may qualify. And if you'll look, it just kind of talks about the different types of affordable private health insurance plans that offer comprehensive coverage, so it kind of gives you a little bit of information. And then it goes on to explain who can use this application. And this application is used for everyone in the household, everyone in the family. It also, because I said it is a single streamlined application that is used for all insurance affordability programs, there are some information that we'll talk about a little bit later in the presentation that we're getting questions from, and I'm sure you'll get questions from the clients, is why we have to ask this information, or why are you asking us about this information. What is needed to apply. Let me just scoot this up a little bit. What is needed to apply. In general, we do ask that they provide this information. We're going to discuss a little bit later, though, if they don't have some of this information, what they should do. The next section asks, why do we ask for this information? And it does give the assurance that we'll keep all of this information that you provide private and secured as required by the law. And then it gives a little explanation as to what will happen next. It tells us to go ahead, tells the applicant to go ahead and complete the application and send it to the address. So it also gives some information down to the bottom, because a lot of the people, like I said, sometimes when they pick up the paper application, they get a little intimidated. So we did want to put the contact information so that individuals could contact us and we could provide that assistance in going through the application process. We'll start beginning with the first step one. As I said, this application was provided by the federal government, so it kind of progresses out. What we've learned, or what they've discussed with us throughout the discussions of the single streamlined application, is that in the past we have always kind of asked about the family member or the family household compositions in a whole. But with this application, you'll see it basically breaks it down into the individual person within that household and asks questions. So you're not asking about the entire household composition all at once, which they found through study groups and through different means of testing the different versions of the single streamline application before it was actually issued in its final version, that was sometimes confusing to applicants when they were asking about information in a lump. So what we've done, or what the single streamline application does, it begins by asking about the person to tell us about themselves. So this is going to be the person that we'll be in communications with in the household. I know many of you with your other applications, you know, that's just the first person on the application. So this is going to be the individual that we'll be communicating with. And then step two, it begins to ask, tell us about your family. And then what we tell them is, okay, these are some things that we really want you to include under the do include sections, and some of the sections that you don't have to include. And again, we've got down at the bottom here the contact information as someone goes through the applications. If maybe they've hit a roadblock or they're not really sure what they should place on the application, that they can call and someone will assist them in completing the application process. Okay, on step two, person one. So again, on this application, we're asking about that first person that filled out under step one, tell us about yourself. So we're asking in step two, person one, we tell them to start with yourself. So we've tried to keep it as simple as possible, because I know there are a lot of questions that they're normally not used to asking or answering. So we've tried to keep it very simple by explaining things like start with yourself. And that we want them to complete this information. And as you'll notice as we progress, each section of the application is about a specific person, about that one person in that household, rather than in the past lumping everyone together in the household. So we just ask for some basic information. And one of the biggest changes with the implementation of the Affordable Care Act is that now we start asking about tax information. And as Annie mentioned, with the Internal Revenue Service, with the Federal Data Hub, there is part of that service is that we have to call up and seek those data sources whenever they're available as the first thing that we do. Only as a last resort would you actually be able to request documentation. If things come back and they're not able to explain the reason that there's a difference from what they attest to on the application and what the return is from the data sources, then we do allow them the opportunity to explain those differences. So we ask about tax filing status if they plan to file a federal tax return next year, and then we just go through and then we ask about if this person in step 2, person 1, asking if they are pregnant, and then if they know how many babies that they are expecting during this pregnancy and the due date if they know that. And if you'll notice here, we've got the question here about our family planning coverage for them to indicate yes or no here. And like I said at the very beginning, we were able to modify and put some things in there that we feel were really, that we wanted to keep in our application. And here's an example of that, where we're asking if they're interested in the Women, Infants, and Children program, or WIC program. And it kind of gives them a little bit of a direction on how to apply for that through their county health department. And then it begins to, let me slide this up here. Ask if the individual needs health insurance coverage. And again, we're talking about this first person. So all of these questions are about person 1. So it progresses and it begins to ask them questions. And if yes, they do want health coverage for themselves, because remember, this is about person 1, which could be the person that's maybe applying for a child or something of that nature. So if they've indicated yes, then we'll need for them to complete these questions throughout the application.
Can I interrupt?
Yes, jump
and
on
ask
in.
a question? So if this is, we're mainly talking about Plan First.
Yes.
So this is a Plan First woman. She wants to apply for Plan First. So she will say yes there.
Yes.
So this health care coverage is about this Medicaid Plan First. It's not, yes, I need comprehensive health care coverage through ACA.
Well, this application, because it is a single streamline application, could be used for the application for the comprehensive health insurance as well.
But the main thing for them to know is
Yes.
if they're applying for Plan First, they need to say yes on that.
They need to check yes that they.
Okay.
Yes.
Okay, thanks.
Great, thank you. And then it begins to ask questions related to maybe disabilities of the individual, and that's why they ask about the physical, mental, or emotional health of that individual, that if they're having difficulties, or if they're living maybe in a nursing home. Next, we're going to ask about person 1. Again, this is all about person 1. We're asking if they aren't a citizen or a U.S. national, and then we ask about their immigration status. So the next one talks about retroactive benefits, where you need to, we still have the capability to go 3 months prior to the month of receipt of application. That still is a requirement, so that's where that question pertains to. This next section here, do you live with at least one child under the age of 19? And that's a question that's related to, as you refer to, as our Medicaid for Low-Income Families program, or which is now being referred to as our patient and our parent and other caretakers. So you'll hear those terms mixed in, together, MLIF, or Medicaid for Low-Income Families, or our parent and other caretaker group. And then it asks some other questions which are optional. Again, at the bottom of the page, we want to include that information about the contact information if they have any questions, or if they come to a roadblock and that they can contact us, and that we will walk them through the application process. Okay. As Annie said, this is the single Streamline application. So we're going through step 2, person 1, and then we start asking about the job and the income information. We ask if they're employed, not employed, self-employed, and then many people sometimes work 2 jobs, so there is a place for them to indicate that if they're working 2 different jobs. We do ask questions like changes in their circumstances, because and if you'll note here on number 26, it's asking things about changing jobs, stop working, start working fewer hours, things of that nature, because if you'll remember when we were talking about the pulling up to the Federal Data Hub and retrieving this information from the IRS, that of course that's information that the IRS has from when they filed their taxes. So some things could have changed from the time that they filed their taxes when they've actually completed the application. So I mentioned a little earlier, we do allow them the opportunity to discuss with us why those maybe it doesn't quite match when we're getting back from the IRS. We also ask about other income. And if you'll look on this section, we do ask about unemployment, pension, Social Security, retirement accounts, alimony received, farming, net rental income, things of that nature.
Yeah, slide it up.
Oh, I'm so sorry.
It's okay.
Thank you. Let me go ahead and scoot it on up here. And one of the big things is that certain income that we used to count, we no longer count due to the changes with the Affordable Care Act about types of countable income. So you'll notice that in some of these income questions, we're not asking for certain types of income. And with the deductions, there are, if you'll think back, the whole concept is to kind of go more with those federal tax rules. When you file your taxes, there are deductions that an individual can make for alimony. And there are deductions that are and that's alimony that is paid, not received. So alimony paid is a deduction that is allowed on the federal tax, as well as student loan interest. So what we do is have them to indicate those amounts there if those apply, and then we ask about their yearly income. And this note here is that complete only if your income changes from month to month, because we do get that a lot with individuals applying. Maybe they're seasonal workers, or maybe we have individuals that work in the construction field where they have really busy times during the year, but then maybe in other times of the year they're really slow. But we do determine eligibility on a monthly basis. So we have to look at their income and consider what that income is for that month of application. So we end here with thanks. That's all we needed to know about you. But wait, there's more. Again, then we begin with step 2, person 2. So basically what happens is, as I said earlier, oops, I'm sorry, I moved the little thing, is that the way that we gather information is that we gather information about each individual in the household. So all of those questions that we've asked about this, that from person 1, we are now going to ask about person 2. Now our single Streamline application allows for 4 individuals to be in the household. So if the person is just applying, for themselves, maybe for family planning, then and they have no other people in their household, of course, they would not need to complete any other sections about any other persons in their home. So I just wanted to go through kind of line by line on person 1, and then on person 2, just show you and illustrate that it mirrors those same questions that we've asked about that person 1.
Okay, let me ask a question real quick here. I'm sorry to interrupt again.
No, you're fine.
You have somebody, before, once that child in the home, the dependent child turned 19, they had to apply for Plan First, that lavender application, by themselves as somebody that had no children. In other words, they didn't do the blue combined sober application because they were no longer eligible. So I'm a mom. I have a dependent child that's 19, no longer eligible for sober coverage. Would that number 2 person be that child that's 19?
We're going to get a lot of those. Yes, we are going to get a lot of those, because a lot of the times they just begin to ask to answer the questions about everyone in their household. So
Right.
what's going to happen is that once we receive the application, then we'll have to decide, okay, is this person eligible under any other coverage?
Okay.
Should they be referred to maybe the FFM for possible coverage? Because with Medicaid, as a child, it only goes until they attain the age of 19.
Right.
So they may have, like you said, an individual in their household that is 19, and they go ahead and list that person as person 2 on the application.
Well, and if they indicate on that question that, yes, we want family planning.
Yes.
So, and that under 7.
Yes.
So that's what we can do, is that
Yes.
if I have a 19 to 21-year-old in my household that's still a dependent, yes, you can apply. I can apply for me for Plan First, and we can apply for you for Plan First. Okay. That's all I
Because,
want.
another reason with that is that you may have an individual in the home, or the applicant may have an individual in the home who is maybe 19 or 20 and a full-time student. Now,
Right.
in those instances, that individual would be captured as part of the person's household. When we talk about the modified adjusted gross income household composition, we have to look at each individual within the household, and that's why the application is tailored in this way, because we have to look at each individual and calculate their particular household. So in that instance, the person 1, if she lists her daughter who is maybe 19 and a full-time student, then she would be able to be included in her household for possible benefits or for possible savings with insurance affordability programs through the FFM.
Okay.
So I'm going to skip through step person 3 and person 4 because it's asking the same information over and over again about all of the different people. But I do want to now move to step 3. Now this is a little bit different than what we're a little used to seeing, in that on step 3 we're going to have to ask questions about American Indian or Alaska Native family members. And the reason that we ask these is that because of all of the income rules have changed with the implementation of the Affordable Care Act. As I mentioned earlier, some income that we counted in the past, we're no longer able to count. Certain income that we may be considered, we can no longer consider. So this indication here will let us know if this individual is an American Indian or Alaskan Native. And we're going to talk a little bit about why those questions are important. If you'll check yes here, it notes be sure to complete Appendix B. So we'll talk about Appendix B in just in a moment. Step 4, ask about family's health insurance coverage. And it asks to answer any questions for anyone who needs health coverage. Is anyone enrolled in health coverage now from the following? And then they have the indication to indicate if they're eligible for Medicaid, for CHIP, Medicare, TRICARE, all of these different types of health insurance. Next, it lists, is anyone listed on this application offered health coverage from a job? Now, we've had a lot of question about that, and I'm going to explain a little bit about why that question is asked. Because if you'll note, it's not saying that do they have health insurance from a job. It says, is anyone listed on this application offered health insurance, health coverage from a job? On the signature page, let me move it down here, sorry.
So, and I'm sorry to
Yes.
interrupt
Oh,
you.
no,
So
you're
let me
fine,
ask you,
please.
so on that one, it's only if you're offered it. So yeah, I'm a state employee. I have my own insurance. I can buy insurance family coverage for my children, but I can't afford it.
Yes.
So what I would put down there is yes, I've been offered it, but it doesn't necessarily mean they're covered. Okay.
Doesn't necessarily mean that they have
Right,
the
that
insurance,
they have it,
but
that
their
they elect to
employer
have
offers
it because they don't feel as though they can afford it.
Exactly.
So they choose not to. Okay.
Under read and sign this application, this is step 5. So basically, we did retain a lot of the information that we had under penalty of perjury related to the application. We've also had some questions about the next little bullet here, where it's directing individuals to apply for. I skipped to to the wrong one. I'm sorry, but it gives them information about discrimination based on race, color, national origin. But this next bullet is the one I wanted to kind of bring your attention to, that we've gotten a lot of questions about incarceration or jail. And this particular question here is that I confirm that no one applying for health insurance on this application is incarcerated, and then in parentheses, detained or in jail. If not, which means that yes, there is someone that's on this application that's incarcerated, then on this line here is going to be the name of the person that is in jail or that is incarcerated. I know we've had some questions about, who goes there. Maybe the person who's filling out the application puts their name there. No, this is the actual name of the individual that's listed on the application who is incarcerated. Let's pull it up here. And then there's a section on the read and sign sections. We have always referred to this as affirmations. You've heard a lot of different things. This page, the signature page is called, but we're trying to just refer to it as a signature page. It does give the individual their rights to appeal. This section here is really new to everybody about the renewal of coverage in future years, and Annie pointed that out, and that is an option within the Affordable Care Act, in that an individual can choose to check one of these years. It is still a federal requirement that we redetermine eligibility annually, but there is an option for the individual to check that that he or she may want their eligibility automatically redetermined each year. Now, that doesn't mean that it's automatic. It means that by checking one of these boxes, either 5 years, 4 years, 3 years, 2 years, 1 year, or do not use my information, basically what that allows us to do is when that person is up for renewal, then we'll be able to reach out to the Federal Data Hub, pull back any returns related to those to the person's eligibility, and if they're eligible, then we can do an administrative renewal on them. So a lot of times you hear it a lot of different names, but we're just kind of trying to keep it simple, saying that it's more of an administrative renewal, and that they won't receive the application or the annual renewal form that they'll have to complete. They'll mainly just get a notice saying, okay, based on the information that was available, it appears that you continue eligible for your program. So we really hope this will allow us to be much more efficient and effective. I know historically we've all seen it dealing with individuals where it comes up for renewal and then they drop off. It's sometimes referred to as a churn rate, and then the next thing you know, maybe they didn't realize that their renewal had ended, and they present and they're trying to get a prescription filled or receive a service, and they're informed, okay, your coverage has ended. We see that a lot. So hopefully this will allow us to keep those individuals that are eligible actually enrolled in the program. So we do ask that they sign the application.
Okay, I'm going to interrupt this
jump
time.
on in.
So if they check the 5-year
Yes.
box, the patient will not have to do anything for 5 years?
Well, what will happen is that each year, because as I said, we are still required to complete an annual redetermination, but when this person comes up that has checked 5, that when they come up for renewal next year, what will happen is that we will send their data to the Federal Data Hub, get back a return, and if it appears based on the information that we retrieve from the hub that this individual remains eligible, they will not have to complete a renewal form. So they'll only receive a notice
That they
saying
were
that they were continue
Re-enrolled,
eligible.
and they
Yes.
don't have to do anything then?
Yes.
Excellent. Okay.
And same thing, and we'll be able to do that every year. But the limit in the law is the 5 years. But then again, they also have the option for them not to use the annual redetermination for the Federal Data Hub. And if they check this, then those individuals will receive an annual renewal form, and they'll go through the whole regular renewal process.
Okay. Thank you.
Oh, you're welcome. The next section is step 6, and that's just where we want to mail the application, this paper single streamline application. Again, it gives information about if anyone needs help with the application, how they can contact us. on the bottom of the section, you will notice that there's a section there about the National Voter Registration Act. That's the NVRA. It is a federal requirement that an individual that is going through what is referred to as a covered transaction, and that is an application, a renewal, or a change of address, that the individual must be afforded the opportunity to register to vote. So if you have a question about that, that's related to the National Voter Registration Act.
So I'm applying for this. We fill this out on behalf of the Plan First woman. The Plan First applications used to go to the Plan First unit.
Yes.
But now all these streamlined applications must go through all kids because there's a process that they're going to do before it gets sent to Medicaid. Isn't that correct?
Yes, and you mentioned a little bit about our eligibility and enrollment system that we've built with our partners at All Kids. So this is, and basically with the change in the law, it required states to become more efficient and effective, and basically have these data service so that we can call up the data service hubs, and because of the law requirement, it was essential that we had to basically build a system that would do these functions. So that's the purpose of the new eligibility and enrollment system, because of the law's requirements, and that we have to check data prior to anything else. You know, that's the first thing. We have to just take the information that is put on the application and reach out and verify the information through third-party data sources.
Okay. So for this application for Plan First, it does go to that address listed under Step 6.
We have
The paper
asked,
application.
now currently, you know, because it is such a massive undertaking, I know many of you are aware of kind of just some of the challenges that are associated with the implementation of the Affordable Care Act, not only at the state level but at the federal level as well. We will get to a process so that these individual paper applications will be able to be scanned in an electronic format and entered into the eligibility and enrollment system. So that was kind of where we're going with, but at this point, of course, those individuals, they can apply at any Medicaid office, but we did place the mailing address for the All Kids for those scanning purposes,
Yeah,
so that
so
we could get that.
any paper apps that we do out in the counties, we need to send to All Kids.
Well, we can discuss that a little bit later.
Okay,
I mean,
because that's a question that we're getting
Yes.
is where do we send these? Because the Plan First apps have always gone to the Plan First unit,
Right.
not through All Kids. And so I didn't know, because this was this universal application,
Right.
if it still needed to go through there. So that's something that we need to figure out pretty quick.
Yes,
So-
it is. Well, it's something that we're discussing
Okay.
right now. Matter of fact, we have a call this afternoon with some of our staff members who have that very same question.
Okay.
Because originally the plan was that we could go ahead and go forward with our scanning, which we would, you know, go through our, All Kids is going to assist us with on the scanning part, so that we wanted those paper applications to get there so they didn't have to get passed through so many individuals. But that is definitely something that we're discussing.
Okay.
And we really want to make sure that we don't delay the application process.
Sure.
So we will definitely get with you on that and make you a part of those discussions.
Okay.
when they're
So as soon
finalized.
as we hear, Meredith and I will send that out. Okay.
That'd be great. I want to talk a little bit about Appendix A, and if you'll refer to earlier in the application, it was asking about health coverage from jobs. This section here it also tells you that you do not have to answer these questions unless someone in the household is eligible for health coverage from a job. And then tell us about the job that offers coverage. So we're going to have this information about the job, about the individual that says that they could get health insurance through their job. And then down at the bottom of the application, it asks about the health plan that's offered through the employer. Now, this is a confusing section to the clients, and you'll get a lot of questions on this, I'm sure. And you know, should I fill it out? Shouldn't I fill it out? How do I fill it out? because it starts asking about an employer-sponsored health plan that meets the minimum value standard, and of course, you know, Yeah, right. If this plan's share of the, and then it gives a little discussion about the Internal Revenue Code that comes up with that definition about minimum value standard. And again, it's very important that we've got that need help with your application, because we are getting a lot of questions there. And that before I leave this, remember this is the section about health coverage from jobs, and we've got information related about a job if they could possibly get health insurance, not only if they've got health insurance.
Let me ask you,
Yes.
on that number 4 under employer information, it asks for an EIN number.
Right.
I know that's on a W-2, but we're going to have a lot of people looking at us with these blank looks.
Yes.
So, you know, can we just leave that blank if we can't get it?
And we're
Because
going to...
it's going to be a problem.
Exactly. And I was going to talk about the next section here, which is referred to as an employer coverage tool. And basically what this is this is the part of the application that the actual individual could complete the part, this top part, and actually take this to their employer and fill this out. What I try to explain to, because we've got a lot of questions about this from our staff members as well, is, like you said, most people don't know their EIN or even know that it's located on their W-2.
Yeah.
You know, so we've got a lot of questions about that, and also from clients, you know, they offer health insurance at my work, but I don't have enough money to get it, you know. So this section here allows you to fill it out to the best of your ability. So to answer your question,
Okay.
we want the information as completed as much as possible. We certainly don't want to discourage anyone from submitting an application because they feel like that they haven't completed it enough.
Okay.
So that's what we're advising, that this particular section, as we said, with this single streamlined application, it is an application that is used for plans that are through the federally facilitated marketplace. So this, when I was looking over the information from the federal government, it does offer certain federal protections or maybe individuals assistance with paying for premiums. So whereas it could certainly come in handy with the plans offered through the FFM, you know, it may not even apply to some of the Medicaid cases.
So when I'm doing this online, there's obviously not a form that I can send to my employer.
Yes.
So if I'm doing this paper, can I go ahead and with that person sitting in front of me and just fill this section out to the best of our ability and let it go in?
Yes.
Because if I give something to somebody to take out of the building,
Yeah.
it's history, unfortunately. So I want to get people enrolled, so that's all I needed to know. I think that's
Yes.
good. We'll complete it to the best of our ability, knowing that a lot of our folk either aren't going to be employed or they aren't going to have employee coverage anyway. So that may be a section, if we're lucky, they won't have to complete. But if they do, do it to the best of your ability.
And we do see that a lot too, and that, you know, definitely, I mean, we have individuals who really may not know their Social Security number, you know, or may
Yeah, we
not.
see that.
So there's always going to be information that we're asking for that we realize that they may not be able to provide, and that we ask them to go ahead and complete the application to the best that they can.
Okay.
Send that in. I referred earlier in the application about the American Indian or Alaska Native members, and basically on Appendix B, this would be the section of the application that the individual would need to complete because of the changes in modified adjusted gross income rules related to implementation of the Affordable Care Act. There are certain types of income related to American Indian or Alaska Native that we will not be counting when we are determining eligibility. So we do have to ask certain information about the name of the tribe. Has this person basically received any money? Let me slide it all up. Any of the money received. It even states certain money received may not be counted for Medicaid or the Children's Health Insurance Program. And then it talks about per capita payments from a tribe that come from natural resources, usage rights, or leases or royalties. So it kind of explains why we're asking these questions about American Indian or Alaska Native members. This is a very new section to the application for what we've historically always referred to as as our kind of like family certification programs. The type of applications that we administer for our elderly and disabled programs, we've always had an authorized representative section, but this is a new section to this, which people aren't real familiar with. But basically what Appendix C does, it allows you to, or the person making the application, to basically assign a representative to act on their behalf. So if an individual has authorized a representative, basically they'll give us the information about that individual that they've authorized to act as a representative for them. And this individual that becomes an authorized representative, they can fully discuss all aspects of the application process with the determining agency. So it basically allows an individual to act on behalf of an individual. When checking on statuses, things, if there's questions, or if maybe we got a data return that didn't quite match to what was attested to on the application and we need some further clarification, well, the authorized representative is able to get into that level of detail. Whereas in the past, we maybe could just offer certain statuses or things of that nature, but this particular authorized representative, they will be able to be fully involved in the application process. This section here on the bottom, I know Meredith mentioned some of the other terms that are related to navigators, agents, application counselors. With the Affordable Care Act, it did implement what is referred to as certified application counselors. Now, certified application counselors, if you'll think about it, they are very similar to what we've had for many years on what we refer to as application assisters, in that those are individuals who are going to assist individuals with completing the application throughout the application process. But these certified application counselors, although they serve the similar function of our application assisters, they are trained by the federal government and they receive their certification through the federal government. You'll sometimes hear them referred to as CACs, certified application counselors. So there are, and the counselors, like I said, they do have to make an application or submit their data to the federal government to receive that training and that authorization and become CACs. Now the navigators are a little bit different in that the CACs primarily help an individual complete the application, but the navigators, they allow the individual to discuss the application, and they've got more of a training related to the different health plans that may meet that individual's needs. So if you think about the navigators, those are individuals that help the applicant navigate those different health plans that are out there in the federally facilitated marketplace. Maybe there's one private health plan that meets their needs better than the other. So those navigators will be able to assist those individuals in going through that process and picking which health plan best suits their needs. And then agents and brokers, those are referring to insurance, because the insurance companies, they can have agents and brokers assist an individual. Okay. I think that's all of the application that we're going through.
And that's your contact information if anybody has some questions for Paul. And so now is your opportunity to call in or email your questions. Please take advantage of this. And while we're doing that, I wanted just to go over just briefly. So my take on this new application, the benefits for our clients and for us is it's just as close to real time as we can get when you do it online. So we get that immediate award. And then that automatic re-enrollment. So this year may be some extra work, but just think, if most people say, yes, you can automatically do an administrative renewal for me up to 5 years, that's really going to cut that business down, particularly of us having to re-enroll because that pink letter was never returned because they didn't really understand what the letter was for. So that's really going to be good. And then when we have the ability to actually access it online, a lot of these pages, because they're going to say no, you're going to skip to the next section, so it won't be actually 16 pages you're going to have to go through like you do with the paper application. So with the online application, let me say this. I couldn't access it yesterday. So I know that everybody's having trouble accessing that. We're working on that. IT is aware. I apologize. I'm so sorry that it's not up and operational, but we're working on that, and hopefully we'll have that available as soon as possible. And I know also that there's been some web browser concerns and what's going on with that. You know, it gets to a technical piece that I really can't even go into great detail, but we know that it's there, and again, my apologies. As far as the paper application, those are available at the warehouse. You can order it through Procure-It, and what you're going to order it as is the same form, or it's under the same title as the old Combine app. It's called CHIP 1, C-H-I-P in capital letters 1. If you put that in the Procure-It system, it'll pull up. They come by 25 applications to a pack. So those, we have 800 and something packets available currently at the warehouse, so you can use those or copy the one that we have sent you. There's some other thing I need to clarify. Unfortunately, I misunderstood. No, after this training, you're not a Medicaid assister. I apologize. I know that was misinformation that I sent out statewide. But apparently there's a Medicaid module that has to be completed. Meredith and I want to do a little bit more investigation. We want to look at that, see how laborious that is, to see if it's really going to be worth the effort, and we'll be getting back with you on that, as well as the online application status and also where you should mail the paper applications. In my opinion, the paper application at this point, it says to mail it to all kids until I tell you likewise. I don't want them sitting out in a county health department and just piling up. You know, let's go ahead and follow the instructions, but you may get new direction. As with any part of this application, as we begin to tweak and learn new things, and you know, there may be some changes along the way, and we'll do our best to keep you informed on that. Another issue that I've heard a lot, particularly from the care coordinators, is great concern of how long this is going to take them, particularly with how they're going to be able to bill their time. I want you to know that if you remember going back to the original Annie plan, when we looked at the process of taking the Plan First application, and we looked at should the clerk do it, should the social worker do it, and that was basically left up to the counties. It was based on your staffing, what you felt would be a more efficient process for you. So I'm saying that again. It doesn't make any difference if it's the clerk, if it's a social worker, if it's a combination of the two. Whatever's the most efficient process, I want to let you know that's what we want you to do. I don't want to direct it from here that only this person can do that. So that's strictly up to you and how you want to handle that. But the critical piece here is if they don't get enrolled, there's nobody to care coordinate. So we've got to get and help these folks get enrolled. So, and I know that you guys, that we're all on the same page when it comes to that. Now, I do want to tell you about a few referral sources, because I've had some concerns that you're going to get some questions and you just don't know what to say, because you know, we really have been given instruction that we really can't assist anybody at the healthcare.gov site. So there may be some questions that'll come up, and I want to help you with those. First of all, there's a really interesting link at the Kaiser Foundation, and it's where a applicant can go, and there's a calculator there that can actually calculate their annual income and determine whether they'll get a subsidy and how much their insurance is going to cost them. So if somebody comes in and says, well, I know I need to apply for this new health insurance, but how much is it going to cost? You can give them this Kaiser Foundation link, and that will give them at least some sort of ballpark figure that their insurance may cost them $600 a year. So, and that you're up, and then you're going to get this subsidy that's going to actually take off this much. So I think that's a good referral that you can give them. Also, there's a website called enrollalla.com. There has been specific groups in the state that got what's been called Navigator Awards, or those people that can actually assist you to apply for any insurance at the federal marketplace. So enrollalla.com. If you can't, you can give them that website, or they can call, or you can call 1-205-918-8192. That number can actually tell them where these folks are located. Now, AIDS Alabama actually got this grant, so they tend to be at those Ryan White sites, but there may be a site within your city where that person can actually go and they'll do it for them. But you can also give this person this phone number, and they will help them know how they can apply for comprehensive health care coverage through ACA. And also, FQHCs all the FQHCs got federal money and are receiving, I think, an increase in that federal money to hire insurance outreach workers. And it was my understanding from a conversation I had with an FQHC yesterday that these insurance outreach workers can also help folk apply for health care coverage under ACA. So you can also refer those recipients to the local FQHC in your area, give them that phone number. So anyway, I hope that these referral sources will help you. You know, everybody hates to tell somebody, you know, I don't know, and that's it. So at least this will be a little bit of additional information that we can give you. And as I learn more things along the way, I'll try and share that with you. So do we have some email questions? Okay.
So we'll go ahead.
Okay, let's wait. Lori, we got a phone call. Let me get this. We have two phone calls first. So let's go with that first phone call. Caller, what's your question? Tallapoosa? Hello.
Yes. My question, the Plan First application is on our kiosk. Do we still let our client fill that application out on the website?
I can handle this one. The Plan First application on the kiosk should be not available anymore as of yesterday. Because now, and that's not the combined Sober app, it's the Plan First app. Now, it's my understanding that the combined app, everybody's redirected to this new application, this new universal application, if all is working the way it's supposed to be working. But the Plan First app, I have requested that that be turned off because Medicaid's not going to take it, or they're going to, what they'll do with these lavender applications that they receive right now is they will send out addendums for all this additional information that they need, and we know how that goes when Medicaid asks for additional information from our clients instead of from us. So it should be turned off. If you find out otherwise, please let me know.
I will, and thank you very much. That's what I needed to know.
Okay. Thanks for your call. Call number 2. What county's that? Colbert? Barber County, I'm sorry. Barber County, what's your call? What's your question?
Barber County, sorry.
Yes, I'm calling from Barber County. I was wondering, why does the application ask if an individual is filing taxes?
I can field that one.
Okay.
With the implementation of the Affordable Care Act, we had to move more toward a tax-based way of counting income. So I guess the short answer is because of the Affordable Care Act mandates that we now look at information based on tax rules rather than the way that we historically have always looked at income by allowing certain deductions. For instance, we allowed like $90 work deductions for employers. All of those deductions have kind of gone away, but we have gone to allowing for different types of deductions, and normally those are the types of deductions an individual can receive when they file their federal tax benefits. But I guess the answer is we ask that because that's what the law requires that we look at when we're looking at accountable income now.
And so is that going to be one of the database interfaces that we're going to
Yes.
use when we're verifying income as well?
Yes.
So
Yeah,
particularly when we
it's-
recertify.
Yeah, it's within the Federal Data Hub. The IRS is one of those individuals.
So that's the reason we have to ask that. Does that answer your question, Barber County?
Not really.
Well-
Sort of, kind of.
Well, now, here, let me try. Because what they're wanting is they're wanting to make this where you don't have to come in and report an income every year, particularly when it comes to recertification. So if I can get your application information, bounce it against outside sources to get accurate income information, then that's what we want to do. We want to try to automate this as much as possible. And so that's the reason insurance information, at least in this country, not insurance, income tax information in this country is probably one of the best ways to determine what you're actually earning. So that's why they ask that. And, because I know Medicaid's already looked at FICA in the past, and because sometimes I'll get Plan First applications and somebody will report a certain income and then Medicaid will deny it because they find out from these income-based systems that, no, they actually earn more than what they're reporting. They actually do have a job because this information for us is self-reported. And for you, so you have to put it down. So I think really going to this income-based or income tax-based is really good because therefore you don't necessarily, it's not your responsibility to verify income anymore. Not that it ever was with Plan First, but it skips some of those verification steps because it's done automatically. We can verify income because it bounces against that hub. Okay?
So it looks at the deductions of an individual.
Yes, because those deductions are already there because the income tax has been filed. Okay. So you would assume that all the allowable deductions are already been taken out, and this shows what your income was. Yes.
What if an individual is making an application and they do not file taxes?
We allow the individual to what's referred to sometimes as the attestation. So whatever they put on the application, of course, we're automatically going to send that data to the Federal Data Hub and say if they've indicated that they don't have earned income, but we get a return back. Now, when we get a return back, a lot of people, there's a misconception that, we'll get their tax information, but that's not really true. The return will basically return a range. So so when the system comes up, it'll say, okay, this person, based on the range that was returned from the IRS, fits into this certain category. So even if an individual doesn't list on the application that they file taxes and they did file previously and we get that return, then that's the point that we have to look at, okay, have things changed throughout the year? Did they indicate on the application that, because they could have filed taxes and not be planning to file taxes for the coming year, so we allow that individual to make those attestations.
So, but that's a good question, Barbara, because
they'll be eligible if they don't file taxes then.
Oh, yeah, they'll be eligible, certainly.
And what about the penalty that is discussed if a person, I know this is sort of going bigger and broader than Plan First, but since we have the expert there, what about an individual who is choosing not to pursue insurance through this means? And there is this supposed penalty, whatever the word is that, if a person files taxes, is that where that is connected? And what about a person who doesn't file taxes? How is that penalty lodged against them?
Well, the questions related to the penalty and whether there'll be a penalty and if they file, how they'll get that penalty, we've been referring those questions to the federally facilitated marketplace because they're the ones that are going to be handling and administering that particular program. With the massive regulations and the changes related with the child health insurance program and Medicaid, we have focused on our regulations, our requirements, what we're required to do, and those information like that we're going to get some questions, and we have gotten a lot of questions. Are they going to penalize me? Things of that nature, and how do they penalize me? Do I get a bill? Do they take it out of my taxes? We're referring those back to the federally facilitated marketplace so that they can better give those answers. We wouldn't want to provide any information that may not be complete or correct.
So healthcare.gov.
Yes, healthcare.gov.
Yeah, so that's the only thing we're going to be able to do.
Healthcare.gov number, or what about that enrollalabama.com, that number, could those persons answer that?
Well, and see, those are navigator sites, and the navigators with the ACA may be able to handle that.
Yes, that may be appropriate.
Okay.
Thank you.
All right, you're welcome. All right, now I know that we have another phone call from Walker County. Hello, Walker, what's your question?
Yes, with this new application, does it get rid of the child care allowance and the work allowance?
Yes, as I mentioned earlier, there were changes in the way that we look at income. Certain income that we used to count, we no longer count. But basically what it did, it changed to a modified adjusted gross income rules. And with that, it's very similar to adjusted gross income. But to answer your question, we do not allow the child care expense, but if you turn around, we do not count child support anymore or veterans benefits, and we allow other deductions such as the alimony paid. So there are all of those income rules that we're kind of used to doing over the many years, applying the $90 work deduction, the child care deductions. Those types of things are going away with the implementation of the modified adjusted gross income rules.
Okay. All right. Does that answer your question, Walker?
Yes.
Okay, thank you for your call. Okay, Lori, you have some emails before I interrupted you?
We'll start and you stop in between. All right, the first one, what about ladies who are separated from their spouse and do not have the information about that spouse on the application?
Okay. On the application, we ask that they just give us the information pertaining to their particular household at the time of application. So if in that scenario, if the individual is not in their household, of course they should not be listed on the application.
Okay.
Second question, same person. What about applicants who don't know details about their employer's offered health plan?
Yes, that's something that we have gotten a lot of questions with, and what we're informing people is just to fill it out to the best of their ability.
Okay.
But and I do want to note that, because this is an insurance affordability program or a single streamlined application that is used for all programs, then there are some questions within the applications that may not even apply to Medicaid.
Okay.
How do we explain the authorized representative on the application to applicants so they can understand what we need them to know?
Okay. Well, I'll jump in there. Basically, the way that we or say someone explains an authorized representative is that this is an individual that can handle the application process from the beginning to the end. Complete contact, they can check on status, they can, if there's a letter that was mailed requesting additional information, they can actually speak for the individual. So that's what the authorized representative does. It allows them a large latitude as acting on behalf of the applicant. Now, as I said prior, we've always had an authorized representative capability, but we primarily utilized it for our elderly and disabled populations because many times they're not, physically or mentally capable of going through the application process. So we allow someone to act on their behalf as an authorized representative. This is the same thing. It just allows someone to act on their behalf throughout the application process.
And I think the best way to say is that if I was explaining it to somebody, this will give me the authorization to follow your application along to whether it's awarded or till it's denied. So I can get that information and act on your behalf.
And even follow up as to why it was denied in those cases.
Which is, everybody always wants to know that as well.
Right.
So.
Okay. And I think y'all may have touched on this, but where are the applications that CHIP has sent us? Or you said something about the procurement,
yeah,
right?
because in my email, CHIP had sent out initially the applications to the Medicaid outstation workers. So there will be no drop shipment. They're at the warehouse. So those original drop ship just went to the Medicaid outstation workers. So they do CHIP 1 and procure it. They can order those today, just as soon as we get off, because Andre's loaded them. They're ready to go.
Okay, this is a good one. This has to do with a 19-year-old and wants to apply for Plan First, but does not want their parents to know. Do they fill out their own application? We see many who are in college and live at home part of the time with their parents. They still do not want their parents to know they are receiving services. How do we protect their confidentiality?
Okay. If someone has attained the age of 19, then of course we look at them as an adult. They can apply in their own right in that instance. So because we do get that a lot now, where they want to apply in their own right, and certainly because they are an adult, they can do that.
And let me say, because we've dealt with confidentiality, it's mainly with a lot with family planning and Title 10. Remember and this situation is no different than even when we were using the Lavender application. If that student is covered under mom and dad's insurance and they apply for Plan First, it's going to deny and it's going to defer to that insurance. And if Medicaid ever pays something and then remembers that they've got insurance, they're going to pay in chase. They're going to go after that insurance company for reimbursement. So then that EOB is going to go to the home. So in my opinion, when you've got somebody that has dual coverage, they need confidentiality. It's better for them it's better for them to not apply for Medicaid, because we cannot guarantee their confidentiality when you've got dual coverage here, and a lot of those college students do. So those are ones that we just need to see under Title 10 and charge a fee.
Okay. This is a two-question. Will Plan First meet the Affordable Care Act requirements? Will the patients be awarded Plan First or full Medicaid?
Okay, well, and I think as Paul had pointed out, it will not meet those minimum standards for the health care benefits, and they will not be given full Medicaid. They're getting Plan First. they have to put on question 7 that they're applying for Plan First. So, remember, we didn't go to expanded Medicaid. I think
Yes,
maybe once we go to
that's right.
Medicaid expansion, we will actually see a lot of this population get full Medicaid, but at this time, the state did not elect to do that.
Okay. Do we count this might have already been addressed, but do we count a boyfriend's income in determining patient's eligibility and list him as person number 2 for the household?
If you're going to the household listening for that individual, you can list them on the application, but as I said earlier, we're looking at individuals within that. Instead of kind of lumping everyone together, like we had done in the past, we look at individuals. So we would actually calculate a household composition for each member within that household. So in calculating those household compositions, or modified adjusted gross household compositions, he would not be part of that Magi household for that person.
Okay, we do have a phone call, and it's from Walker County. Hello, Walker County, what's your question?
Yes, I have 2 questions. This is for Spanish-speaking clients. And how about for the clients that don't read or write in any language?
Well, and that's why we've got our care coordinators to assist them, or our clerks. I will say that the Spanish is not out yet. There will be, and I understand it doesn't make any difference. If you can't read, you can't read. But we will have a Spanish application out. It's just not in at this time.
I'm sorry, Ann.
No, go ahead.
But all Medicaid staff, they are required to offer assistance to anyone wishing to apply, certainly. We do have resources available for our workers, such as the language line, things of that nature that we will certainly want to utilize. And especially not only people that, can't speak the language, but certainly with difficulties maybe reading or maybe a little intimidated with such a large document by just looking at it. We certainly have Medicaid staff available to assist those individuals throughout the application process.
Okay.
Well, as yesterday with the Medicaid co-workers here at Walker County, they told me that they don't have no applications with them and they're not giving anything to the clients when they come to their office. And I went to their site and I didn't see anything on that except where they have the website in English.
Okay, the Spanish paper application, it isn't currently available, but there are available paper applications.
But it
The
sounds like
Medicaid workers, are they going to still talk to patients?
Oh, definitely, yes.
They told me yesterday they're not talking to patients to the clients anymore.
I'll follow up with that site, but yes, we will certainly certainly continue to offer assistance throughout the application process.
All right. Well, thank you.
Thank you.
wait, I got a call now from Tuscaloosa. Tuscaloosa, what's your question?
My question is, I think you answered it, and we were paying attention, but I'm just not totally sure I understand. On person 1, when you're applying for yourself, if the patient is just applying for Plan First, does she check the second part of number 7 and she checks yes on number 8?
Okay. So they would check, you're talking about the second part, do you want to apply for a family plan cover? Yes,
Right.
they would check that, yes. Now, we would encourage them to go ahead and complete the application because, as we referred to a little bit earlier, it doesn't, family planning only doesn't meet the benchmark or the standards, so these individuals could possibly be referred to the FFM or Federally Facilitated Marketplace for a plan, possibly through the insurance affordability programs that they offer.
So we would answer yes on question 8 as well.
Yes.
Is that good, Miranda?
Yes, I understand.
Yeah.
Thank you.
Okay, good. Thanks for your call. What? No more calls. Okay. Lori?
If a patient's household members change and they have marked anything other than the 1-year automatic renewal, say they marry after 2 years or whatever, how will these individuals' income be linked for her eligibility, especially if they don't file income taxes together?
Well, with the administrative renewal, we are able to go out and retrieve that data, but we will still send them a notice saying that based on the information, and within that notice we do ask that they report any changes, which that is something that we ask anyway throughout the whole time that they're eligible for any type of benefit, that they report any changes that could have an effect on their eligibility. But it may not have an effect on their eligibility, but once they get that administrative renewal notice, we'll list, what data that we used based on that we found you continue to be eligible. At that time, the individual would contact us and let us know that, okay, we forgot to tell you that these things have changed, and here's our situation now.
Okay. That makes sense. All right. Just sort of clarification point, what does the FFM plan stand for?
It's the federally facilitated marketplace, and basically what it is that it's the federal government running the health insurance exchange in Alabama. Many of you are familiar that we did not choose to expand. Well, one of the options also was that the state could run their own state-based exchange. But we have chosen to allow the federal government to run the health insurance exchange, and in those instances, and a number of states have done that, not just Alabama, but those are referred to as the federally facilitated marketplace. So that's the federal government health insurance exchange in Alabama and a number of other states.
Okay, makes sense. Okay, for families of more than 4 members, which 4 should be entered on the application?
Well, we want to have everyone entered on the application because it is quite a large application. We do ask that if there are household members beyond the amount that we have available, that they just make a copy of the section for additional household information and send it in for each member that's beyond the 4 that the printed application allows.
Can the ADPH case managers be authorized representatives so that we can follow up on the application?
If an individual indicates that they wish to appoint the individual an authorized representative, yes, there's no limitations as long as the person making the application appoints that individual as their authorized representative.
And we fill out that section on Appendix C.
Yes, ma'am.
Mm-hmm. Right. Okay. Do all applications, this may be to be known, but do all applications need to be mailed to all kids for the counties who have Medicaid workers?
We're going to follow up with that.
Yeah, we're going to follow up on that one, yeah.
But our Medicaid workers in the field, I'll just follow up, not directly to that question, but all of our workers in the field are currently seeing patients, so certainly no one should be sent away when we have a Medicaid staff in a location. We are there to serve that client.
Okay. We're still good. All right. Are the county's clerks, social workers, going to be responsible for filling out the applications while the patients are in the clinic? What if the patient does not want to apply? Also, what about the length of time to complete the application with the patient in front of them? How will this affect our clinic flow and wait times?
Well, and that's one of the things you're going to have to look and learn with your process. You have to remember back when we started this application, I heard the same thing. Nobody wants to complete it. They look at it and they just say, no, I don't want to do it. I'm going to give it to you and you're going to walk out the door. It's all these issues. It's the same thing. Now, granted, we certainly have gone more than 3 pages. I think once the electronic application is up, I think there's going to be a lot of these sections we're going to skip. And it was even like when we put the Lavender application online, it got down to where I had a lot of workers that could do that in less than 15 minutes. And got within 5 to 10 minutes because they got used to the questions, they knew how to ask them, and they could get through it real quickly. I have to say right now, I know as you begin to first do this process, there's no way you're going to be able to do this one in 5 minutes. I know that. But the thing is, we got to get them enrolled. And how can we get them enrolled before they leave the building? Because if we let them leave the building, it's not going to happen. So, and Medicaid is a good portion of our reimbursement. So we've got to figure out ways to make this work. Now, it may be that you give them the paper copy and they complete it and fill that out. Somebody checks that quickly. It sees that all the information's there that you need, and it's entered by somebody at the end of clinic. So there's different sorts of ways that we can do it, and I want to give you permission to come up with those different ways. But I think bottom line is we got to get them enrolled. I'm hoping that once the online application is really working and you don't have to go through 16 pages, that it'll be a lot better and a lot quicker. But as with any new process, when you first start, it takes forever, and I understand that. And I think that's one thing with cycle times that I'm going to look at. I can basically say cycle time back before the new Streamline application was a lot shorter than now that we're working with the Streamlined application. So that's one thing that certainly at the central office I'm going to take into consideration. It's taking us longer.
Okay. Regarding Appendix C about the authorized representative section, I think you've already addressed who can do that on their behalf. But can the application be faxed to the number noted on Step 6? Can it be faxed?
Let me look. Is that the signature page?
No, that's where it has the health insurance. Step 6.
I see.
Go to Step 6.
I'm sorry.
The all kids address, and there's a number if you need help.
Oh, okay. Yes. Okay, and the question is, can we accept a fax application?
Right. Can it be faxed to the number noted on Step 6?
Currently, we do not allow fax applications to be submitted. Okay. But we are definitely encouraging individuals to apply online. That's going to be the quickest way. There's different methods to submit an application under the Affordable Care Act. The person can certainly apply, online, through the mail, in person, but they also have the capability by the regulation to apply over the phone. So at this time, we chose not to go with the fax.
Okay. We got another call from Walker County. What's your question?
Yes, I just heard that Medicaid workers are seeing patients still.
I'm
sorry.
When they come to the office, are they being seen by the Medicaid workers?
Yeah, patients are supposed to still be seen by the Medicaid workers.
Yes, Medicaid staff does see anyone wishing to apply, or if they have any questions, anything in general, and I'm definitely going to follow up on your concern.
Yes, sir. All right, because I just want to make sure, because I'm the interpreter at the health department, and they asked me, I don't work in Medicaid directly, but I want to make sure what I can tell the patients, because yesterday I got 2 English-speaking patients, and I'm asking me because they went to the office and nobody can talk to them. So I just want to make sure that when we approach here at the health department on the weak side, when they come over here, that they can go and talk to someone.
Right. I don't know how long you may have been there, but our workers do have what is referred to sometimes as a paperwork day, and that they will take, one day to kind of, if it's a multiple worker site, we'll never have both workers on a paperwork day at the same time. We'll stagger those paperwork days, but workers do have what is referred to as historically a paperwork day, and that they take that day to kind of process those applications that have come in through the mail, been dropped off, doing some data entry and things of that nature. So it may be that that was one of those paperwork days. I don't know, but I will certainly follow up. But yes, Medicaid does see people.
Good, thank you.
Thank you.
Okay.
Just so you know, we've got about 7 unread, and I'm not sure about time, so just let me know.
Okay.
Okay. All right. Will the case managers be given accounts, or do we create accounts to be authorized representatives?
Okay. On the online application, the person making the application creates the account. And I don't know if that's the account that they're referring to, but it would actually be the person creating or making the application.
Okay. Also, when we are audited, this is on the case management side, they mark off on our audits if the patient is eligible but does not apply. So if the 19-year-old who will not want to apply to protect her confidentiality now, how do we need to note this so we do not look like it was not offered and why she didn't apply?
You put it in the progress note somewhere. You put it down that we attempted to apply, patient needs confidentiality, was concerned that if they applied for Plan First because of dual coverage, because they're covered under private insurance, just you put something in there so at least there's some sort of trail that the auditor would know. And if you've done that and you get an exception, let me know.
All right, I'm just going to read. I'm trying to screen, but hang on. In the past, we've had patients with both private coverage, Blue Cross and Plan First, dual coverage, via ACA, and this new application, will this still be the case? How will this affect the ability of the care coordinators to assess patients with dual coverage?
Well, I'll kind of address some of that, and
Okay.
feel free to jump in. With Medicaid, we've always allowed individuals to have Medicaid as well as private health insurance. So that particular issue isn't going to change related to Medicaid. But if you'll remember, family planning or those type of services do not meet the requirement. But
So
we
you-
have always
yeah.
allowed them to have other health insurance as well.
So I really don't think there's going to be any change. I mean, because the waiver doesn't meet the minimum requirements, so it's not full Medicaid. Now, where I could see there could be a possibility would be, but not really because of financial. If I had full Medicaid and now suddenly I get ACA, Blue Cross Blue Shield. But I think that you would fall into that income bracket. Well, you could right now because we didn't expand Medicaid. If that individual was willing to pay for it, but really, just the simple way to answer it, it's not going to be any different. It's not going to be any different because you can have family planning and you can have ACA, Blue Cross Blue Shield through the federally funded marketplace, and you would still qualify for Plan First. So there should be no change. Now, we'll still have to get go for that Blue Cross Blue Shield payment and get either denied for service or get payment for it, but just like if they have private insurance now, won't be any different.
Okay. Okay. In this particular county, they say we no longer have an outstation Medicaid worker at our health department. What about applicants needing application number to enroll as soon as possible in Best Start? And what if they have problems with transportation to customer service centers in Huntsville?
Okay. Because in that particular area, we did pull in some workers to a customer service center but we do still have outstation workers in some locations throughout that area of the state. But certainly, if they can contact Medicaid, then we can direct them to the closest office. But again, we're going to certainly encourage that individual to apply online because that's going to be the quickest way that individual could possibly be eligible for benefits. As I said earlier, our online application, we hope will get to the point so that we'll have real-time or near real-time eligibility determinations. So it's going to be a much quicker process. But in particular, that particular area of the state, we do still have some outstation workers that are located in FQHCs and things of that nature.
Okay, we do have another phone call from Limestone County. Limestone, what's your question?
Well, that was my question that I had emailed in, and we are in a situation where we no longer have an outstation Medicaid worker. Well, that was my question about the Medicaid worker. We don't have outstation Medicaid workers.
Yeah, did that help? Did Paul's answer help you?
Well, not
really?
entirely because they don't. We're being asked to refer people to the customer service center in Huntsville, and some of our patients don't have transportation to get there, and they also are not comfortable with the online situations because they don't have online capacity at home and they're not familiar with using that type of application.
You know, the only other thing I think that you could do, if this was me and this was a pregnant woman, is, well, first of all, we got to make sure our kiosks actually work and you can actually get to that site. But I would encourage them to bring a friend, and I know, and I'm not trying to make light of the situation, to see if maybe they've got a friend or somebody that they can bring in. The only other thing I can think is there anybody at the Best Start program that would be willing to come, once a week maybe and take these applications? Maybe you can give them a call. Because I know it's a dilemma for you. What do? You don't have a Medicaid worker, and Huntsville's not close to Athens, really. So that is a problem.
Yeah, and I'd like to jump in there, too, in that, we will certainly never require anyone to go into an office to make an application. They do have the other methods of submitting an application, but I understand that it is better if you have someone that kind of assists them throughout that process. And that's where we're going with, we hope to expand our application assister program so that we can actually certify individuals who can process or assist that individual throughout the application process. So we're definitely looking at expanding even our application assister program. We've got a pretty robust application assister program now, but a lot of those are located in your hospitals. We've got some that are in some of our FQHCs. We've trained quite a few in our FQHCs, but primarily you've got them in your hospital. But that application assister certification could be an option in that instance, but we would never require or say that you have to go into a customer service center or travel anywhere to make an application when there are so many different methods that an individual can submit an application.
Right, and that was just a suggestion for them to go there for help with doing an online application, and that was because they were concerned about getting into the Best Start program as quickly as possible.
Yeah. Oh, and of course, and that's what we want. We want to get them into prenatal care as soon as we possibly can. I agree with you.
And I'm not familiar with the Chip One system for ordering applications, and since we have no outstation worker here, could you elaborate on how that works?
Yeah. The Procure It system is our warehouses inventory system, and in each office there's somebody that has access to that. So any other form or anything else you've ever had to order from the warehouse, they have access to Procure It. And so all they have to do is when you're going in, and the Chip One is the name of the form. That's what you pull up to see if you've got that, if they've got any in, and then that's how you order it. So if you want 50 of them, they'd order 2 packs. So ask your office manager or your lead clerical person. I guarantee somebody there knows. Somebody's got access.
Just CHIP-1.
That's what I've been told. It's capital CHIP-1, and that should pull it up.
Thank you.
You're welcome. Okay, we got another phone call from Shelby County. Hello, Shelby. What's your question?
Hi, my question is in regards to the Plan First waiver. It's our understanding that the waiver will be expiring at the end of 2014, and would like to know, are there any efforts being made to apply for another year or 5 years of the Plan First waiver for care coordination?
Oh, certainly. We don't want to lose the waiver if we can, avoid it. And actually, because it was going to expire in 2013, we have already started writing it. So it will be due. We'll probably have to submit it usually 6 months prior to authorization. My guess is we'll have to submit it in June. And then we'll go through that process of special terms and conditions and going back and forth with CMS. So as long as CMS says that we can have waivers, and as of this time I've not heard that we cannot, we are going to apply for one. And I think even if they make a waiver now where they're a bit more specialized, where you'll see traditional things in there or things that are not non-traditional, like let's say smoking cessation. We want to build our waiver around smoking cessation, or we want to build our waiver around a reproductive life plan and more of a prenatal, my mind's gone blank as far as interconceptional counseling. That's another area where I've seen waivers go. It's trying to get women in between those babies as healthy as possible. And so they've often used case managers and workers with that. I know Georgia's got a waiver that's similar to that, and so does Louisiana. So if we can't get the traditional one that we've always applied for, we'll certainly look at other ways, because I'm a firm believer in care coordination. And we certainly want to keep you folk out there to help us in the family planning program.
Thank you.
Mm-hmm. Okay, Lori, you got it. Nick? No more calls. All right.
Okay. Keep going? All right. Okay, since we are referring patients to the healthcare.gov site, after completing the applications, and it is a universal application, will the application information be transferred to the marketplace, or will the patients have to completely enter the same information again there?
Okay. It is a single streamline application, and the concept is the no wrong door concept. So they can enter through the FFM, they can enter through Medicaid, they can enter through CHIP. So, and what will happen is that that particular they will be found eligible for whichever program applies. So no, they would. That's the whole concept behind the single Streamline application, is that they can enter any door and then access any of the insurance affordability programs that they may be eligible for.
Okay. If the patient applies for only Plan First and does not want to list her children with the application, will the application be kicked out like it used to be, or will the coverage for her go through if she's eligible? Did I make that clear?
It used to, when it first started, that the governor's office specifically wanted children enrolled in insurance. And I think because the whole purpose of this is to get everybody enrolled as much as possible, that yes, she's going to have to put her children down there, because we want the governor, and these are stats that the federal government looks at. How many children in your state are actually covered by insurance? So it'll be the same thing. That won't change, and that's a big governor's initiative as well. So I'm going to have to say we're going to have to go. We are totally out of time. What Lori, I'll have you do is forward those questions to me, and we'll answer those email questions. I'm sorry if we weren't able to get to your email question, but thank you so much for those of you that sent those in and those that you took the time to call. I hope this has helped, but you certainly know how to contact any of us if you have any other questions. Paul, thank you so much for your time.
Thank you for the opportunity.
Being willing to do this for us. Meredith and I desperately needed your help, as you can see. So without further ado, I'm going to say goodbye and for today, and thank you for joining us here at the Alabama Public Health Training Network.